Today we had a patient that needed a cast after surgery. He had a calcaneal fracture. After a patient has surgery, sometimes they are placed in a cast. It's very important to have a patient at a 90-degree angle due to the patient having a calcaneal fracture, and trying to get him at a 90-degree, pushing or putting any kind of pressure on his foot was causing severe pain. It is better for a patient in that situation with any kind of trauma or any kind of surgery that involves that kind of pain. It's better to have a patient lay down on their stomach. Basically, we work with gravity. As you see here, the patient is better. She's more comfortable. Gravity is doing its job in keeping her foot as closest to 90 as we can. Once we put fiberglass, the fiberglass will slowly start to make the foot go towards a 90, and we won't be putting too much pressure and having the patient feel so much pain. The fiberglass is heavier, and it's heat. Basically, it starts conforming, and you kind of put a little bit of pressure to get you closer to the 90, but because gravity already has her foot like this, it helps. So basically, I'm just doing everything like I normally would with the normal cast when she is sitting down. We're gonna go 50-50, and you're gonna conform. So we put padding, enough padding, especially to the heel area where the fracture is at. Basically, it helps keep the foot supported and protected from the fiberglass itself, because it does harden, and protect any tendons, ligaments, and all your lovely bones that we have. On a cast, you want to feel for their tibia and their fibular head. Basically, you do not want to go past that. So I'm going to go ahead and feel for that, and this patient will be using a knee roller. So what we do is we add a little bumper to provide a little bit more comfort for the patient, since their knee is going to be on that knee roller. You don't want the cast rubbing against their shin and causing some pain or any kind of damage to their skin. So I'm just going to add a little extra padding for that reason. So cold water basically helps the fiberglass heat and harden a lot less quicker, versus when the water is warmer, it basically gets harder faster. So mine is at room temperature, and that's because I want to make sure that this patient is at a 90-degree. When you do fiberglass, you never grab from the roll, but you grab from the sides.
Why?
It messes up your technique, and you're basically putting in dents that you shouldn't be putting on fiberglass. So we're going to do 3 layers.
Where are you starting at?
Below the 1st and 5th med head. And you want to be able to move your toes. So I'm going to do 3 layers, and then I'm going to go 50-50 all the way around. First row, I want to make sure that I get enough around the heel, Achilles, and I don't want any wrinkles. So
Why don't you want wrinkles?
Because once the cast hardens, it's going to leave dents that can start causing issues, especially for like any kind of patients that have skin issues, ulcers, diabetic patients. You don't want that to occur by a dent, and it can cause discomfort for a patient. Important role, basically this is where I'm going to make sure that she stays at a 90-degree. I'm wrapping from the side because I have a clear view that she stays at 90. And if I'm wrapping from this side, I can't really tell whether she's at 90 or not. So looks are deceiving. You want to make sure your patient is feeling all right. Should they feel nauseous or anything, make sure you get a cold towel, some water, and never leave a patient unattended. So I'm going to work my way back up 50-50. So this is where I check that my cast is smooth, and I'm at a 90. I want to make sure that I see all 5 toes. If we need to trim a little corner piece by where her pinky is at, we sure can to provide a little bit more comfort for her. So I'm gonna go ahead and do that. Can you wiggle your toes? Okay. And then I'll fold the bottom part. Alright, now I will put my color. And do your 3 layers here as well. And then I'll just work my way up. We're going to smooth out any kind of bumps or any wrinkles you see as you go. At this point, the patient should be feeling that it's getting a little warm, and that's just the cast itself. Once it starts getting warm, it basically means it's starting to dry up, and it'll start hardening up. So this is my last roll. I'm making sure that she is at her 90 degree. I'm smoothing it all out, and then at this point, we will allow at least 5 minutes for the cast to fully dry. Make sure the patient is feeling well. And we make sure that the patient is not getting any kind of cramps. Should they get any cramps, should they get the cast wet, or should they stick anything or find something abnormal such as discoloration to the toes turning black or purple, they should immediately call us or go to an emergency room.